Hey guys, Leo from MMT. We're going to be doing some low back treatment with Shan, specifically some stuff on the sacrum, which is a key area of that low back and hip complex and can sort of open up a lot of freedom and movement for that area. So Shan, bit of low back pain that's going on.
Yeah.
You're kind of feeling it in that kind of tailbone, sacrum area. I guess tell me a bit about it. What's it feeling like? Achy?
Yeah, dull
sharp?
ache.
Yep.
On the occasion, kind of down the leg.
Down the leg as well.
But really just kind of numb, especially if I'm not utilising glutes properly.
Sure.
It's just taking over.
Is it that same leg that you've done your ACL on, like the numbness and stuff, or?
Kind of, it moves both sides.
Okay.
Depending on the leg.
Okay. And how far down the leg do you get it? Like past the hamstring into the lower leg as
Yeah,
well?
yeah, down.
Like a tingling?
Okay.
Okay.
Yeah.
Okay. Are there any movements that I guess aggravate it or like flare up that pain down the legs or the low back pain?
Sitting.
Sitting.
Is probably the main one.
Cool. So like sitting for like extended periods of time, and then kind of getting up.
Yeah, and then just just when I'm not thinking of doing my exercise properly, and it tends to just.
Okay. What about like any movements in the spine in terms of, I guess, bending forward or bending backwards or side bending? Do you feel any increased tension or sensitivity?
I know it's always like, when you extend back.
Extend. Do you want to just stand up for me?
Yeah,
go for it. So maybe just like have your feet hip width apart, legs, so knees locked out. Just have your palms on your thighs here. Just come into a bit of a forward fold. Any stretch pain, anything through that area? Any tingling down the legs, anything like that?
It's just a bit tight.
Just a bit tight. Alright. And if you stand up straight now, kind of keep the legs locked out, hands kind of on the back of your leg or just tracing your thighs. Just come into a bit of extension for me. What does that feel like?
Yeah, on that left side.
On that left side?
It's pretty jarring.
Jarring. Kind of on that S side, that sacrum kind of thing?
A little bit higher QL as well.
QL as well? Alright, cool. We'll use that as our kind of benchmark.
Awesome.
Let's get into some treatment, Shan. So face down when you're ready.
Turn this off.
That can stay on if you want. Yeah, that's cool.
Too much.
Yep. Let's get a towel on there. Alright, just going to tuck into the hands. Alright, now you said, I think for this purpose we'll work on a bit of the right side, a little bit of both, but. So I'm just going to start on the sacrum with a broader stroke. So I'm just trying to connect in here and palpate the spine of the sacrum. So pretty much following the spine the whole way down. That sacrum is a fusion of the vertebrae at the sacral level. So it's this big bone at the base of the spine, and if you look at it under the skin, there's a lot of different fascial or connective tissue fibers here, and it's kind of like a crisscrossing of fibers, So you could say that there's like spiders in there. There's the way you look at it on an anatomy chart. We might get one put up here on the video, but it's, I think, pretty indicative of the different forces that get translated through this area, being the center of gravity of the body as well. So I'm just kind of, increasing my pressure, putting my body weight on it, staying connected to the bone. And it's just a good way to connect in to the lower back. Shan, how's that feeling?
Yeah, really good. It's going to come up to something soon.
What'd you say?
Something's going to come up soon.
Something's going to come up?
Feel that?
So any referral at the moment or just pretty localized?
Pretty localized.
Yeah.
It's hitting a bit of the front as well.
Yeah.
So,
like referring kind of through to the front?
Yeah.
Okay. So because there's so much connective tissue here, you've got the thoracolumbar fascia, you've got your lats that kind of connect into the lower back here, your lower back musculature, your spinal erectors, you got your glute tissue that comes and connects in here as well, and then even your obliques and sort of abdominal muscles, those sheaths sort of wrap into the fascia that surrounds this sort of center of gravity of the body. So it can have sort of global referral associated with this sort of treatment as well, as can other areas of the body. But like connective tissue wise compared to muscle tissue, there's just a lot of it here. So a good opportunity to get it cleaned out. Still referring through the front, Shan?
yeah, it is. Just lightly.
Okay. So I'm just going to work my way up the sacrum to start with. Pressure okay still?
Yeah, perfect.
Let's go. So still trying to stay connected to the skeleton, to the spine of the sacrum, right to that middle spine. And I'll run into the iliac crest, so the hip here. And it's just a good opportunity as well to trace that hip bone and just get some awareness of where the client's pelvis is. Some iliac crest or hips can come up quite high, some a lot lower. So it's just a good way to get a broader idea of exactly where that hip bone goes to. So once I kind of cleared out that superficial level of fascia, I've hit some deeper levels as well on the sacrum. I want to get into a bit of a deeper treatment. So boom, we'll bring out the bigger tool from the shed, jump in with an elbow. So you might have seen some money spot videos on our YouTube channel as well, and that's where I'm gonna head right now to start with. So just a bit higher than the sacrum, bottom of the lumbar spine. Shan, how's that feeling?
Yeah, that's on the money.
That's on the money. So as the name suggests, the money spot's kind of your best bang for buck. Again, I just spoke about all the different sort of fascial connections that tie in here from the different body parts, and we're pretty much pinning that central part of it on the right side anyway. So any referral on this one?
No.
Just pretty localized and intense?
Yeah.
Out of 10, how intense would you say?
Like a 6.
Okay.
So we got a bit deeper, but it's feeling good. Feels like it's just getting into it slowly.
Yep.
So it's nice.
So I'm just working my way kind of deeper into that money spot, making a connection with the top of the sacrum as I start to pull down towards the feet or that distal direction. So it might just be or become a bit sort of sharp and burny, Shan, as I try to jump up onto the sacrum from that money spot. So far so good?
Yeah, yeah.
Any change of sensation? Still quite intense?
Yeah, it's definitely more intense here.
Yeah.
But I feel like this is probably where it needs.
Where it needs it, yeah.
It needs it. It's
kind of like a deep itch that needs some
pretty,
scratching.
yeah,
Pretty therapeutic. So yeah, I can feel my elbow now connect with that lip of the top of the sacrum here. So just being careful to just angle my pressure a bit more broadly and not too acute with the tip of my elbow until I can hop on the sacrum safely. So that's probably the transition right there. Shan, how's that feeling?
Yeah, good.
So just like with the opening stroke, guiding my pressure towards the midline of the body, staying connected with that spine or the spinous processes of the sacrum, and just kind of driving through that crisscrossing of fascia and connective tissue. Really helps to open up this space and sort of subsequently all the other muscles, fascial attachments that connect in here. How's that there, Shan?
Oh, good.
So yeah, sacrum stuff can feel like really therapeutic, probably because it's an area that doesn't really get sort of touched or treated often.
Yeah, there's something there.
Something there. So always checking in with my client, because obviously it is quite a sensitive area as well. There's a lot of nerve endings here that kind of exit the spine. Less muscle tissue or minimal muscle tissue that can sort of soften the blow, I guess. So we're directly on the skeleton here and the connective tissue. So it's important to just keep checking in with the client as we just work our way down the sacrum. So far so good still?
Yeah. It's it's more intense. It's getting more intense the lower you go.
Yeah.
Are you working that way? Like, or
no,
down?
I'm going down. What does it feel like? Where can I be?
I think you're on. You could probably
Yep.
sharpen it a teeny bit. Yeah. Yeah. That's great.
Any referral in the sacrum here, Shan? Down the leg or anything?
No, it's very local.
Okay.
I think it's going out into the hip a
Yeah.
little bit though, as expected.
So yeah, the further down we work, I guess the more we're impacting some of the fascia that ties into the glute tissue as well. And some of those referral patterns into the lateral hip.
Yeah, that's nuts. So that's going down the leg now.
So here we've got some referral down the leg, and I can pretty much take this stroke as long as, you know, for as long as the sacrum allows. Like, it will turn into the coccyx and the tailbone, which can be a great area to treat as well. So just staying connected, the sacrum kind of rounds like this. So I'm, I guess, trying to accommodate for that by changing my angle to match the angle of the sacrum as we get closer to the tailbone.
Yeah,
That's on the money there, a bit of spice. So yeah, depending how low you need to go, we can take it as far as the tailbone, but it's good to kind of finish and just sweep it out into the glute tissue. Get all that waste product away from the midline of the body and back into the muscle tissue, back into the blood supply, so that the body can clean it out and deal with the rest. And it's usually a pretty good line that the glutes like as well. So alright, we'll just finish off into the hip like that. Untuck the towel. We'll get Shan to just sit up slowly and just take her time to get up, and I guess just have a sense of what that might feel like.
Yeah.
Feels a bit looser, a bit freer.
Yeah.
Any sensitivity to it at all?
No, it just feels real nice.
Okay, awesome. Well, yeah, you heard it from Shan. It feels pretty nice, but it can also feel quite bruised sometimes, depending on the client, because we've been treating right on the bone, on the skeleton, and it's an area that often doesn't get touched that much.
You get used to it, though.
You can, it can feel like it's kind of been beat up a little bit, but oftentimes, it can feel really therapeutic and just a really, really good way to unlock the hip and lower back thickness. So come check out some of that treatment. Hope you enjoy.
Awesome.
Thanks, Shan.
Thanks.
Good stuff.